Hi, good afternoon. My name is David Pokhrel, and today I'll be presenting my presentation on the topic of quality improvement at Sunnyland Medical Clinic, that is SMC. Here today I'll explain the existing workflow and analyze the data of the clinic. Also, we'll learn about some of the specific problems that we are facing with overall data analysis and the overall evaluation. We'll look at the possible options of how we can solve the problem, and we'll derive some of the possible solutions. Here, as we can see, the current workflow, where the patient comes into the clinic and is checked in by the receptionist. The nurse then summons the patient into an exam room, inquires about the reason of the visit, takes vitals, performs a medical review, and conducts some learning style assessment. The same nurse is also in charge of the documentation for several surveys on smoking, mental health, and lifestyle. After all of this, the nurse may finally put their notes and protect the workstation. The nurse then turns over the patient to the provider. The provider then reviews the nurse documentation before administering the exam. The provider then arranges the orders and enters the visit notes and all the fall risk information. With this workflow that we are facing right now, we can see some of the automation part is missing. Hence, we can see some of the data are being miscarried out. Here, as you can see in the current situation, from the workflow that we studied before, the data is being generated. We can see this is an EHR audit record from Sunnyland Medical Facility. Here, it shows the outcome of data inputted from the nurse's assessment for the purpose of visit, vitals, medical reviews, and questionnaires during a 6-month time span. According to the most current provider efficiency profile, PEP, we can see data on fall risk assessment is not being recorded. Lack of fall risk documentation is unacceptable since the organization is accountable care organization, and fall risk is a safety effort for the clinic. Hence, we discovered a problem within the workflow. As illustrated by previous chart, we can see this is an annual comprehensive visit audit requiring the learning style questionnaire, which is 77% complete, the smoking questionnaire 99% complete, depression screening questionnaire that was 67% complete, fall risk questionnaire was 0%, that is missing. Thus, that proves there is a lag in workflow. Lifestyle questionnaire is 68% complete, and social determinants of health questionnaire is 46%. Moving forward, here we can see SMC presently has an inefficient clinical process. Currently, there is a waste in the efficient use of resources. By having the nursing staff handle the majority of intake, there are delays in patient treatment. This time-consuming procedure hinders patient flow and can affect both providers and on consumer side. There also appears to be no automation, allowing patients to do activities by themselves. Here, as we can see on the intended workflow that I have presented, the overall workflow seems to be the same as we have before. We can tell that the workflow before had a problem with the process and how the data was collected in the clinic. As we can see here in this intended workflow, I have added an EHR and a cloud backup. So all the workflow, whatever the nurse has recorded and the questionnaires, will be handed over to the physician, and before securing the workstation, the physician and the nurse's documentation will be uploaded into EHR system, which is further being backed up by cloud storage. Here, as you can see, for all the data into the EHR, the data will be saved and will be more easily accessible to the nurse and the provider facilities, hence saving time and cost of the clinic. Service, administrative enrollment, billing, medical records are some of the examples of data collecting systems that are used in healthcare. Data analysis occurs when we cleanse, transform, and model data to uncover the information we require. The present data collecting approach is insufficient. As we can see, data is not being gathered, saved, or processed appropriately at the same time or the same point. Understanding the types of frequency of data mistakes in the clinic's EHR will be critical. We must also consider if there is genuine grasp of the variety underlying data. Time limitations may also play a factor for the poor data quality. We must look at data errors such as substitution, systematic bias, random bias, and missing data. We should also look if there is communication and collaboration gap between the platforms. Justification: as the clinic has failed to develop a robust workflow and data analysis system, the fall risk questionnaire is not being registered, and the present procedure does not ensure that it is working properly. EHRs, electronic health records, are the first step in transforming healthcare. The following are some of the advantages of electronic health records. Better healthcare via enhancements to all areas of patient care, including safety, effectiveness, patient satisfaction, communication, education, timeliness, efficiency, and equity. Further moving, as we can see, implementation best practices requires great attention to details. Some of the concerns that may need to be addressed in the clinic are as we can see, education of clinical and non-clinical staff, providing fall prevention education to all the nurses with a focus on night shift and weekend personnel. Maybe that will prevent the questionnaire to being filled again and again. Fall prevention training for professional disciplines other than nursing and all the rehabilitation services, including pharmacy, doctors, medical residents, and non-clinical staff. And on the other side, we can see maybe by implementing communication channel and creating systems for the department to notify the admitting department of the patient's risk factors for falls. That will improve handoff tools across the department and shifts. Here we can see workflow redesign, a critical step. Workflow redesign is the process of mapping out current processes and examining and tallying how the company achieves the overall goal on the future. Planning for the future by determining how EHR will generate new workflow patterns to increase organization efficiency and healthcare quality in the future. Here, as you can see, on the solution A, as on healthcare facility or within all the organization, we know every minute matters when it comes to productivity, and the present workflow structure is not working and is insufficient for effectively gathering all the required data. As you can see, the nurse might do the fall risk assessment, document it, and then provider could explore it further, which can be more beneficial. The collaborative method should be as follows during the check-in and check-out. When occurs during each set procedure, which will result in a better workflow where the information may be captured more efficiently and effectively. The nurse appears to oversee the patient fundamental assessments. Thus, the nurse might do the fall risk assessment, document it, and then provider could explore it further. Before entering the exam room, the practitioner should be also going through the patient's chart. If the data is not being gathered, since it is not being recorded, the nurse can do the overall assessment and the provider can finish it. Patients can even submit onboard documentation online or at check-in. This may contain surveys, and it could also mean to ensure that the data were completed when the patient arrives by further checking that the information was recorded in the system. The new workflow design will enhance procedures that will optimize a workflow by giving the correct information at the right time. Clinical personnel will double check to ensure the fall risk assessment, if it was completed. The nurse will start it and the doctor will finish it. If you did any sort of onboarding for patient, the information should already be available for cross-checking, saving time and cost. Patient flow improvements minimizes staff workload and improves patient experience and satisfaction. That is on the advantage of the solution A side. On the cons, we'll be asking the initial questions can frustrate or irritate the patient during the second round of questioning. Also, it can be costly in terms of management and human resource allocation, training, and budget. And during the initial phase of implementation of overall EHR, it may be costly and time-consuming. The second option or the second solution is to speak with a member of the staff, run through the procedure to determine the source of the problem. To further understand where the gap is, we must first examine how it is now to be carried out. We should conduct a more thorough examination of the clinic office arrangement to pinpoint potential bottlenecks. Further conducting internal meetings or trying to better understand the whole workflow layout. We get to the bottom of the problem. We involve employees and boost morale of the employees. That will be on the advantage side of the solution B, as the staff will be more involved and will be more motivated by understanding each and every step of the problems and by telling within the departments. But on the cons, it will be more time consuming and it will be more costly. As a conclusion, we don't know exactly what's wrong with the clinic's operation until we further investigate, and we won't know for sure until we review and study the overall method and technologies involved. We need to figure out where the disconnect point is, why the system is not being able to function properly and record all the data. The system could have been adequately accessed from the outset, which improved implementation and acceptance. By optimizing EHR utilization, as we discussed before, clinics may increase the quality of patient care while also increasing the overall operational efficiency. Using EHR, future is a fantastic solution and an idea. How to resolve the problem due to inadequate knowledge, it is unknown where the real problem is. There may be numerous areas that we might have to research further. So, how can we address this problem? We collaborate to guarantee that the proper data is generated and that is done in a timely way. As we can see, the further enhancing EHR interface may be a solution. Creating a patient journal map and providing an overall picture of the process may be a solution. With further implementing EHR and training overall staff within the clinic will be the final step of our conclusion, where we can troubleshoot the system and tally the overall report on a timely manner. I want to thank you all for your time and patience. If you have any questions further, please feel free to ask me anytime.